Hi. Do I go? Okay. Hi, I'm Dr. Shipley. I'm one of the veterinarians at the Houston SPCA. The topic this week is to talk about what to expect at your vet visits. And so we'll jump into our exam today. This is Miss I'm terrible at pronouncing her name. Excelsa, I'm sorry. But she is one of our cute little puppies that are available for adoption. She'll probably go pretty quick, so I just have to warn you, there's plenty of puppies to go around. But she came in from one of our cruelty cases. She was from a hoarding situation, and so luckily she has made a full recovery from her situations, and now she is ready for adoption. And so we're going to jump into our exam today, and I'm going to show you all a bit about how we do our physical exams and what we're looking for. And so I do my exams from nose to tail. Some veterinarians will do tail to nose, but I like to do nose to tail just because it makes more sense to me. And so I'll start looking at their nose first. I make sure that there's no discharge. She likes to chew on my fingers, but no discharge, no sorts of blockages to their nose. Make sure that the actual nose part is a nice color and a nice texture to it. And then I move on to their mouth. And so she's got really nice sharp chompers right now. But we also use their teeth to figure out how old they are. So Miss Excelsa here is 3 months old right now. So based off of how many adult teeth are grown in right now, that's about how old she is. And so we use that. Also in our older pets, we look to see if there's any dental tartar. If there's excessive dental tartar, then that might mean that your pet needs a dental procedure or dental cleaning. With that, sometimes they'll also need teeth extracted, just like us. And so that is a good thing to look at while we're doing our exam, to know if we do need that in the future. But since she's so young, she doesn't need a dental anytime soon. She'll be getting her adult teeth here soon. Okay, so then I move on to the eyes. I make sure the eyes are nice and clear, no discharge coming out of them, and that they're able to see. And then I move on to their ears. And so with their ears, I make sure that those are nice and clean. And if there is any debris or inflammation, we're able to diagnose an ear infection off of that. And so we look at that. So then I move on from here to their lymph nodes. I will check their lymph nodes in their neck and their shoulder right here. With that, if they're enlarged, that could signify an infection or maybe cancer. And so we just have to make sure that they're nice and small and round and not an abnormal shape to them. And so then after that, I move on to their chest. And so the things we're looking at there is their heart and their lungs. And so she wants to eat my stethoscope. But we will use the stethoscope to listen to the heart, make sure that there's no murmurs, no muffling to it. I make sure it's a nice lub-dub pattern to it. And so if there's not, then that could indicate some sort of disease. And then I move on to their lungs. Their lungs need to be nice and clear, almost as if I can't hear anything, pretty much. And so if I do hear something, that could indicate that she might have pneumonia or, some sort of respiratory infection. So we have to always make sure that those are nice and clear as well. Then we go on to the abdomen or the belly area. And so veterinarians will always feel on the abdomen, or palpate is what they call it. And so by feeling around, after a while, we get pretty good at knowing what is a normal abdomen. And so with that, we feel to see, are the organs a normal shape, a normal size? Is it painful? Is it non-painful? It's supposed to be non-painful. But if it is painful, it could signify maybe they ate something they weren't supposed to, maybe something is stuck, or maybe there's some sort of disease process in their abdomen that we need to go searching for. And so that is kind of what we feel for in their belly. And then I will usually use this opportunity to look at their skin, just because most of the time if they have fleas, they're going to be living over the little back end area here. So I'll just kind of part their hair up just to see if there's any fleas. And she does not have any fleas because she's on prevention, which we'll get to here in a bit. But yes, so we look for fleas, we look for flaking, itchiness, red skin, that type of stuff, because dogs love to get allergies. And then I will go on to their musculoskeletal, which is basically their legs, to see if they're nice and non-painful. So we'll put them through range of motion, which means that we're extending the hip, which she obviously doesn't care about, which is good. And then we'll also feel on those front legs as well. Make sure that they're not painful. Make sure there's no swelling. And then I won't do this to her today, but we will take a temperature usually, and then also maybe do a rectal, which I don't want to do that to her today because that would be mean. So with that, that's kind of what we go through on our exams and what we're kind of looking for. Our routine exams are super, super important just because we want to get a baseline as to what is normal in your pet. It is extremely important due to the fact that if there is a disease happening, because you see your pet every single day, you may be missing something that you just don't see is happening. Maybe arthritis or something like that. And so with a routine checkup, sometimes those can catch the diseases that you may not be seeing at home. Another good thing with routine exams is that by getting a baseline as to what is normal, we're able to, whenever something is wrong, as in like you have an emergency situation or your pet is sick, then we already kind of know what they look like normally. So we're able to compare it to something. So that's a good reason to get a routine exam.
And so how often do we need these routine exams?
Yeah, so routine exams are really great to have once a year. It's usually done at the time that they get their vaccines and their heartworm testing and all that type of stuff. But once a year is about average for routine exams.
And then will there be additional testing done at these exams, or what is a typical additional test?
Yeah, so additional testing can include heartworm testing. It can also include fecal testing. So right here we have what we call a fecalizer. So these little things your vet may have, and we can always send clients home with these, and they're able to collect their own stool sample at home, which is really helpful for us because we don't have to get it manually, which is not always comfortable for the pet, and so that's always helpful. So fecal testing will test for intestinal parasites, and then heartworm testing is the two major ones. Other additional testings could be yearly blood work if you have a senior pet. It can also be any sort of testing if your pet already has a pre-existing condition.
And then how often should my pet get like blood work done? Is that, just for emergencies or if they're feeling sick?
Yeah, so it depends. I would say it depends on your pet's age. So routine blood work is very, very helpful so that you have a good baseline as to what normal is, kind of just like a routine exam. So with blood work, we're able to evaluate the kidneys, the liver, the white blood cells, red blood cells. So there's quite a bit of things that we're able to look at on blood work. And so with blood work, it is very, very helpful to get it in your senior pet at least once a year. Even if the year before it was normal, it's still very helpful just because older pets love to get different diseases like kidney disease, liver disease. As much as age is not a disease, it does still sometimes lead to more issues in your pet. So you just have to get blood work to monitor for those things.
And then what's the difference between like a normal pet exam versus like what constitutes an emergency? Like, okay, we can't wait for the annual checkup. We need to go now.
Yeah. It really depends on your pet's symptoms. So if it's something like vomiting, diarrhea, that type of stuff, we really depend on your history that you get. So is your pet one that is one to eat something it's not supposed to?
Yes.
If it does, then it probably does warrant a vet visit immediately, just because if something is stuck in there, you need to go in and get it out, or induce vomiting or whatever it may be. So it's hard to answer just because it's a very subjective type of situation.
No more so like if they're not eating for like 2 days or receive vomiting, diarrhea.
Yeah, so anything that's abnormal and excessive, I would say, warrants a more immediate visit. If it's your pet vomits once after eating too fast, then it may not warrant warrant a vet visit. But if it continues to vomit for 2 days and it just will not eat, then that definitely would warrant a vet visit.
And I know so many people ask, they call the vet and like, this is wrong. Why can't you just diagnose my pet over the phone? So how do we answer that one?
Yes,
that's the main thing we want to know.
That is a great one to touch on because we get this all the time. So I always have people sending me pictures and text messages and stuff. And it is so difficult to diagnose animals over pictures and descriptions and that type of stuff, because we really rely heavily on our exams, being able to touch it, to feel it, to see it, and sometimes even to smell it, which is kind of gross, but we rely on it. It can indicate infection if it smells bad. So there's a lot that goes into an exam that to a normal person you may not see that it's that worthwhile, but to us it is a huge difference, and it's very difficult to determine what's going on through a picture.
And are there different vet specialists that we should go to, or should we just go to like the main vet and then they can direct us?
Yeah, so normally it works sort of like humans, where you'll go to your primary care physician and then they will recommend you go somewhere else, whether that be a gastroenterologist or a dermatologist, and so that's that's kind of how it is here too. So with animals, there are animal specialists, just like humans, dermatologists, soft tissue surgeons. There's several different specialties. And so with that, we usually they will come to a primary care physician first, or primary care vet first. And then from there, they will we will tell you where to go from there. So you need a cardiologist or a gastroenterologist, and then we'll direct you from there.
Another question is, what would my veterinarian ask me about my pet during an exam?
Yeah, so usually it starts in the history section before. Sometimes it'll be before the vet even comes in. A technician will come in and ask you questions, and those are to get a generalized history as to what's going on with the pet. And so with that, we'll ask about, has your pet been vomiting? Has it been having diarrhea? Is it coughing? Is it sneezing? Is it showing any sort of urination issues? Is it defecating normally? Just generalized history questions to figure out, is there any changes to your pet since our last routine visit? If there are changes, then we can kind of hone in on that idea of that change, and then figure out, should we worry about this? Is this possible disease? That type of stuff. So it's different questions based off of the history will help us figure out what's going on with your animal.
And if somebody visits, a low-cost clinic just for their vaccines, do they still need to go to, a full-service vet, or what are the differences?
Yeah. I've actually brought my own dogs to a low-cost vaccine clinic. I think they're wonderful for people who can't necessarily afford to go get their vaccines somewhere else at like a primary care vet. There is usually at least one veterinarian on site, but they don't normally do exams on your pets. And so it is still very important to go to your veterinarian at least once a year for an exam. Again, to make sure we know what's normal in your pet, to make sure that those vaccines didn't cause any issues. They don't typically, but just to make sure. Excelsa's having a lot of fun. I'm jealous. But just to make sure that there is nothing going on with your pet that you may not realize at home.
And do dogs have insurance like we do?
Yes, they actually do. So that can help pay different bills. So with pet insurance, there's several different companies out there. They all work a little bit differently, but in general, they all start with a deductible. Deductibles can be per case, like per visit, as in like if your dog had a UTI and you went to the vet for it, there's a deductible for that UTI, and then there would be another deductible for the next condition. So it's per condition, or you can find one that's annual deductible. And so it really depends on what works best for you. Usually the price of insurance will go up as your dog ages, as in us too. As we age, we get more conditions, so insurance the price will go up. And so with insurance, the way it works typically is that you will go to your vet for your visit. And if you bring your dog in for a UTI, you will do all the diagnostics, whatever you may need, medications prescribed. And then at the end of that visit, With human medicine, typically you wouldn't have to pay anything or maybe just a copay. But with pet insurance, what happens is you still have to cover your vet bill. But then after, you take the receipt and your records and send it into the insurance company, and then they will reimburse you from there. So just make sure you understand that you do have to still pay your vet visit, but they will reimburse you once they have cleared your claim.
And then getting them in as puppies is best.
Yes, it's very helpful to get as puppies. And some insurance companies have like wellness plans too, where they'll cover not just sick visits, they'll also help you cover like routine vaccines and that type of stuff.
If, my dog is scared to go to the vet, are there any tips to help prevent that fear?
Yes, that is a huge one. So lots of animals hate going to the vet. All my dogs are terrible going to the vet. And so it is common, and it's not just you. So things that can help with anxiety in pets. So the first thing would be to just first of all, to always discuss it with your veterinarian. There are certain anti-anxiety medications that you can use the day of or maybe the night before going into your vet visit. So there's different drugs out there that will help with anxiety. I do that in my own dog. It works best, but some dogs, they don't respond to it. So it really depends on the animal. Other things you can do is training. So a lot of different trainings like agility or maybe scent work, that type of stuff, that will build your dog's confidence. And in that way, if they have more confidence, maybe they won't be so scared in certain situations. Another thing with training is that whenever they're puppies, like Excelsa over here, getting them used to being touched everywhere is extremely important. So always, whenever you're sitting on the couch with your puppy, touch on its ears, touch on its nose, touch its feet, touch its tail. Make sure that they're used to being touched everywhere, because we're going to be touching everywhere as veterinarians. And so if they're already used to it, it can help reduce their anxiety. And then the last thing is that with anxiety, some pets get more anxiety whenever they're around their owners, because I think their owners have a feeling of anxiety going to the vet because they know their dog's going to get anxiety, and that's a vicious cycle. And so never get your feelings hurt if the vet staff asks if they can take your dog or your cat to a separate room than the actual exam away from you, because a lot of animals will either feed off your energy, or some dogs will be protective over their owners. And so a lot of animals will actually do better away from their owners, only because it reduces their anxiety, and they don't feel like they have to protect you. And so don't ever feel bad if they do ask that, because they're just trying to do what's best for your animal.
And then we've heard the term Fearfree vet clinics. What is that?
Yeah, so Fearfree is a kind of a newer topic. It's been happening for the last few years. And veterinarians and vet staff can be certified in what's called Fearfree. And then also vet hospitals can be certified as vet-free. And with that, or Fearfree, I'm sorry. So with that, what that means is that there's a certification course that you take, and it's different tactics on how to reduce pet anxiety on their vet visits. So it can be as simple as avoiding scruffing a cat. Cats can get pretty anxious if you scruff them, and so with Fearfree, if they're certified in Fearfree, then there's other types of way to restrain a cat than scruffing. You can burrito them in a towel. You can use Feel Away, which we have right here. So it's a spray, it's a pheromone spray that can help reduce the anxiety in cats. And so there's different tactics that you can use. And Fearfree will teach you about that. And so if you find a practice that is certified as Fearfree, then you can assume that they're going to be a little bit more trained in reducing that anxiety in your pet.
And kind of along with, that anxiety, are there any vets that ever come to the home and do home visits?
Yeah, absolutely. So there are what we call mobile vets. You just kind of have to look at your area to see if there are any. But there are mobile vets. Some of the vets actually have an entire hospital on wheels, which is really cool. Almost like a mobile groomer that comes to you with a truck. Yeah. It's the same thing. So they'll come and they'll have all the medications you may need. And if they don't have it, they can always call it into a pharmacy. And so there are vets that can come visit you at home, so you don't have to necessarily transport your animal to a vet clinic and create that stress.
And then what are some preventatives that my vet can recommend for my pet?
Yeah, so prevention is key to our animals. It's huge in veterinary medicine. So With prevention, the generalized prevention would be heartworm prevention, flea and tick prevention, and gastrointestinal parasite prevention. So usually you can find heartworm prevention that's monthly. I think there's one that's on the market that's every 6 months and every 12 months. And so it just depends on what product you like. And with that, you also should discuss with your veterinarian what's the best product, just because some dogs that have maybe a seizure condition or something like that should get certain types of drugs. So we just need to make sure that we're picking the correct product for you. Some of the preventions we have here, so we have NexGard and Revolution. There's just different types on the market. There's, a very large amount of prevention on the market. But really, I would discuss it with your veterinarian. Make sure that it fits in your price point. Make sure that it fits your lifestyle, and that you're able to dose it as frequently as what it asks for.
And then, is it common for owners to ask for like nail trims or anal glands expressions at vets, or is that like, you do that at home?
No, that is very normal. So a lot of people can't do their own nail trims, own anal gland expressions, and so that is very normal to ask that at your veterinarian's visits. And normally the vet staff will gladly help you. It may be a little extra fee, but yes, you can ask for it. So today we talked about what to expect at your vet visit. And so with that, we hope that you visit our campus, that you're able to pick out your forever pet, and we hope to see you soon. And we are open every day of the week, so there's no excuse you should be here. So, all right, y'all have a great day.